Overview of the video. Welcome to our video on Alprazolam, a medication commonly used to treat anxiety and panic disorders. In this video, we'll discuss what Alprazolam is, how it works, its medical uses, dosage and administration, potential side effects and risks, and whether it's safe for use during pregnancy or breastfeeding. Let's get started. Introduction of the video. Alprazolam is a medication used to treat anxiety and other related disorders. It belongs to the class of drugs called benzodiazepines, and is commonly prescribed under the brand name Xanax. It works by enhancing the effects of a neurotransmitter in the brain known as gamma-aminobutyric acid, GABA. Different brands available in the market. Xanax. Xanax is the most well-known brand name for Alprazolam. It is commonly prescribed to treat anxiety disorders, panic disorders, and depression. Alprazolam Indensol. This brand name is a concentrated liquid form of alprazolam that is used to treat anxiety disorders and panic attacks. Niravam. Niravam is a fast-acting form of alprazolam that is used to treat anxiety disorders and panic attack. Xanax XR. Xanax XR is an extended-release form of alprazolam that is used to treat anxiety disorders and panic disorders. Alprazolam ODT. Alprazolam ODT is an orally disintegrating tablet form of alprazolam that is used to treat anxiety disorders. Alprazolam ER. Alprazolam ER is an extended-release form of alprazolam that is used to treat anxiety disorders and panic disorders. It's important to note that while these different brands of alprazolam may have slightly different dosages, forms, and administration instructions, they all contain the same active ingredient, alprazolam. It's important to always follow your healthcare provider's instructions and to only take medications that have been prescribed to you. How Alprazolam works. Alprazolam is a member of the benzodiazepine class of drugs, which act on the central nervous system to produce anxiolytic, sedative, hypnotic, and muscle relaxant effects. Benzodiazepines enhance the activity of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain, which helps to reduce anxiety and promote relaxation. Specifically, benzodiazepines bind to the GABA receptor complex, which opens chloride ion channels and hyperpolarizes the neuron, reducing its excitability. This leads to a decrease in the transmission of nerve impulses, resulting in a calming effect on the brain and body. Alprazolam has a rapid onset of action and a relatively short duration of effect, making it useful for the treatment of acute anxiety and panic disorders. The exact mechanism of action of alprazolam is not fully understood, but it is thought to act mainly by enhancing the effects of GABA in the brain. Alprazolam has a high affinity for the alpha-1 subunit of the GABA receptor, which is thought to contribute to its anxiolytic and sedative effects. Patients should always follow the guidance of their healthcare provider when taking alprazolam or any medication. Uses of alprazolam. Alprazolam is a medication that is primarily used for the treatment of anxiety disorders, panic disorders, and anxiety associated with depression. Here are some medical uses of alprazolam. Anxiety disorders. Alprazolam is commonly prescribed to treat anxiety disorders such as generalized anxiety disorder, social anxiety disorder, and obsessive-compulsive disorder. It helps to reduce anxiety and improve feelings of calmness and relaxation. Panic disorders. Alprazolam is also used to treat panic disorders, which are characterized by sudden and unexpected panic attacks. Alprazolam helps to reduce the frequency and intensity of panic attacks. Depression. Alprazolam may be used in combination with antidepressant medications to help treat depression. It can help to alleviate symptoms such as anxiety and agitation. Insomnia. Alprazolam may be used to treat insomnia in certain cases, although it is generally not recommended as a long-term treatment for sleep disorders. It's important to note that alprazolam should only be used under the guidance of a healthcare provider, and that it can be habit-forming and potentially addictive. It should not be used recreationally or without a prescription. Dosage of alprazolam. The typical starting dose for treating anxiety disorders is 0.25 to half a milligram taken orally 3 times daily. The dosage may be gradually increased as needed, up to a maximum of 4 mg per day. For panic disorder, the starting dose is usually half a milligram taken orally 3 times daily. Dosages should be individualized and adjusted based on the patient's response to the medication and any side effects. Administration of alprazolam. Alprazolam is usually taken orally, with or without food. Tablets should be swallowed whole and not chewed, crushed, or broken. The extended-release form of alprazolam, Xanax XR, should be taken once daily with or without food. The orally disintegrating tablets, alprazolam ODT, should be placed on the tongue and allowed to dissolve, without water. Precautions that should be taken before taking alprazolam. Alprazolam should not be taken with alcohol or other central nervous system depressants. It can impair cognitive and motor performance, so patients should be advised not to operate machinery or drive until they know how the medication affects. Abrupt discontinuation of alprazolam can result in withdrawal symptoms, and the dosage should be gradually tapered off under the guidance of a healthcare provider. Is alprazolam safe for pregnant or lactating women? Alprazolam is not recommended for use in pregnant or lactating women, as it can potentially harm the developing fetus or nursing infant. Studies have suggested that benzodiazepines, including alprazolam, may increase the risk of congenital malformations, neonatal withdrawal symptoms, and developmental delays in the fetus if used during pregnancy. Additionally, benzodiazepines can pass into breast milk and may cause drowsiness, feeding difficulties, and other adverse effects in nursing infants. Therefore, it is important for pregnant or lactating women to discuss the risks and benefits of alprazolam use with their healthcare provider before taking this medication. They may consider alternative treatments or medication options that are safer for use during pregnancy or breastfeeding. Warning should be keep in mind before taking alprazolam. Alprazolam can be habit-forming and potentially addictive. Misuse of alprazolam can lead to overdose, serious injury, or death. Patients should not exceed the prescribed dosage or take the medication for longer than prescribed. Alprazolam should only be used under the guidance of a healthcare provider, and patients should be monitored for signs of abuse or dependence. Patients with a history of substance abuse or addiction may be at increased risk for misuse of alprazolam. Alprazolam can impair cognitive and motor performance, and patients should be advised not to operate machinery or drive until they know how the medication affects them. Alprazolam can cause drowsiness and may increase the effects of alcohol and other CNS depressants. Abrupt discontinuation of alprazolam can result in withdrawal symptoms, including seizures, and the dosage should be gradually tapered off under the guidance of a healthcare provider. Alprazolam should not be used during pregnancy or while breastfeeding, as it may cause harm to the fetus or infant. Alprazolam should not be used by patients with narrow-angle glaucoma or a history of allergic reaction to benzodiazepines. It's important to note that this warning slide is not comprehensive and that patients should always follow the guidance of their healthcare provider when taking alprazolam or any medication. Risks and side effects of alprazolam. Common side effects of alprazolam include drowsiness, dizziness, fatigue, and impaired coordination. Other side effects may include headache, nausea, vomiting, dry mouth, constipation, and changes in appetite or sex drive. Alprazolam may cause changes in mood, including feelings of depression or euphoria, and may increase the risk of suicidal thoughts or behavior. Rare but serious side effects may include allergic reactions, difficulty breathing, seizures, and hallucinations. Patients should seek medical attention immediately if they experience any signs of an allergic reaction, such as rash, hives, swelling, or difficulty breathing. Long-term use of alprazolam may lead to physical and psychological dependence, tolerance, and withdrawal symptoms. Abrupt discontinuation of alprazolam can result in withdrawal symptoms, including seizures, and the dosage should be gradually tapered off under the guidance of a healthcare provider. Patients with a history of substance abuse or addiction may be at increased risk for misuse of alprazolam. Patients should not stop taking alprazolam without first consulting their healthcare provider. It's important to note that this list of side effects and risks is not comprehensive, and patients should always follow the guidance of their healthcare provider when taking alprazolam or any medication. They should also report any unusual symptoms or side effects to their healthcare provider. Conclusion of the video. Alprazolam is a benzodiazepine medication commonly used for the treatment of anxiety and panic disorders. It works by enhancing the effects of the neurotransmitter GABA in the brain, leading to a calming effect on the body and mind. Alprazolam can be effective in treating these conditions, but it also carries risks and side effects, including the potential for dependence, withdrawal symptoms, and misuse. Patients should follow the guidance of their healthcare provider when taking alprazolam, including following the recommended dosage and tapering off the medication as needed. Alprazolam is not recommended for use in pregnant or lactating women, as it may pose risks to the developing fetus or nursing infant. It's important for patients to report any unusual symptoms or side effects to their healthcare provider and to seek medical attention if they experience any signs of an allergic reaction or other serious adverse effects. Overall, alprazolam can be a useful tool in managing anxiety and panic disorders, but it should be used judiciously and under the guidance of a healthcare professional. Here are the references.